All right, guys, welcome to the video here in beautiful St. Petersburg, Florida. Today to share with you guys a story of a one-on-one coaching client of mine who was recently able to completely avoid ACL surgery, ACL reconstruction surgery after a complete ACL tear a few months ago. I'm going to share a little bit about his story and what we did to get from point A to point B, and here to show you guys specific routines that you can implement in your training so that you can try to do the same. Now, before we get into it, I wanted to very quickly remind you guys that I do have a full platform full of classes, routines, programs meant to design specifically for injured people, for injured athletes who are trying to get back into their sport, who have been dealing with injuries for a long time, and to strengthen those weak areas and slowly and through progressive overload and strength training alone, be able to be reintegrated back into their favorite sports, do what they love at the level that they want. The platform's called Move Mastery Kinstretch. You'll find all the links for it in the description. Feel free to ask me any questions about it either here or on Instagram. Happy to help with you guys with whatever you guys need. And I hope to see some of you guys in there very soon. Now, Charles came to me around February or March of 2025 of this year. Originally, we had a call. He was a referral from another client of mine. They're all from the island of Bermuda. To my understanding, the island of Bermuda is a very active place, as in everybody kind of plays sports. He does MMA, soccer, they sprint, they do a lot of sprint, they have a lot of sprinting competitions. Apparently there's a sports day where all the adults in the island kind of play sports, and they're all very involved, which I think is great. I think it helps, just overall very good environment, amazing thing to do. But what happened was that he had a complete ACL tear around that time period, potentially probably while training for some of that stuff. And so we ran an assessment together. At this time, Charles was struggling to even walk and do daily functions. He could barely, sit at work was bothering him, showering was bothering him, just daily things that are normal to do were incapacitated because his knee could not move well. He came to find out later that it was a complete ACL tear. We ran an assessment together and we found, of course, a big limitation in flexion and extension. His actual knee rotation was actually fine. And so most of the focus you guys are going to see on the routine is going to be on that end range of flexion and on that end range of extension. Slowly we work to reintegrate and regain control of those very deep end ranges of motion, both in flexion and extension, as well as maintain the ranges of rotation, which he already more or less had a pretty decent control and range of motion and rotation. And so lots of isometrics, lots of pails and rails, which if you guys don't know what they are yet, you will in a few minutes. And that was the bulk of the work in the first few weeks, was that isometric work and that load-bearing capacity work for the connective tissues of the knees, paired up with a lot of blood flow, a lot of movement, a lot of neurological reinforcement of that area, which I will also go over for you guys in a second. But it was with this work that after a few weeks, Charles was completely cleared by his surgeon. He was supposed to do the operation. Surgeon ended up telling him he probably doesn't need to. I'm gonna put this text on the screen right now of the exact message that he sent me. Said that whatever the hell he's doing, to keep doing. The surgeon didn't really understand what the heck was going on, but I don't really care as long as we're able to have him play sports again without needing to get under the table. For me, that's good enough. So next up, I'm going to be sharing with you guys the routine, the specific routine that we used in his specific program for us to get to the point where we are right now. Right now is July 2025, so almost 3-ish months in. I think this is week 10 of the whole process. I believe might be 11. But two major things that we used. In the beginning, a blood flow routine, which we did daily, sometimes more than once a day. Very important in the beginning. Blood flow and neurological connections are probably the biggest needle movers, just because whenever you injure something, your body's automatically going to try to detach the nervous system a little bit from it. So because it knows it's hurt, it doesn't want to use those tissues that much. And so it's important for us to reintegrate, to make sure that our nervous system wants to use those areas so that they start getting nutrients and blood flow and CNS connection there. If not, it becomes a revolving cycle. You don't use it, it gets weak. You don't use it, it gets weak. You don't use it, it gets weak, to the point where it snaps again. And so whenever there's trauma, it just speeds up that process and continues that cycle over and over and over again. And we need the intervention to break it up and bring that part of our body that's injured back into the full body and reintegrate it back into the totality that is your movement spectrum. So for this new routine, we progressed from 50 reps per exercise in the first week, 3 times a week. Then we did 75 reps per exercise, 100 reps per exercise, and then 125 reps per exercise. The knee that can do more work is the knee that can do more work. And so for us, progressively overloading, literally us in that knee joint was what created the first initial change, at least in the blood flow side of it. So I'm gonna show you guys first the blood flow routine, and then we'll get into all the isometric capacity stuff, which targets more of the tendons, the ligaments, and the cartilage of the knee. This is more just to bring nutrients, bring awareness of the nervous system back to the knee. So first step was our knee cars, the regular knee cars. If you guys have seen my full body cars routine, the joint function routine, if you guys have gotten that from my Instagram, if you haven't, go ahead and get it because it's great. You should be doing that every day. If you guys haven't, it's the exact same movement. I'm gonna show it real quick for you guys. Forearm to the back of the knee. Make sure that you have a lot of tension. I want you guys to breathe in through your belly, squeeze your core, squeeze your arms, squeeze your quads to the best of your ability. Lift that toe up, rotate inside, and make sure you're aware of what that new rotation looks like, inside, outside. We're gonna kick out while we are in internal rotation, keeping that 60% irradiation on our core and on our quads. Externally rotate and bring it back. And reverse it. Kick out with our toes facing outwards, bring them inside and back down. And that is the complete 1 rep of knee cars. I had him doing about 50 to 75 reps of these in the first 2 weeks, 3 times a week. Just so you guys understand the amount of volume that it takes for you to get results in the beginning. The more frequently you can bring blood flow to those tissues in the beginning, the better. So I want you guys to go ahead and practice. I'm gonna show you guys one more time. If you guys wanna loosen up a little bit, I'm gonna do it a little quicker just so you guys understand what the tempo looks like. Boom. And that when I'm doing the knee cars, I'm never passively getting anywhere. So whenever I'm bringing the knee in, I'm trying to use these tissues, squeezing my hamstring in, twist out, using my quads to push my foot out, twist in, using my hamstrings to bring it back in. I'm always squeezing the stuff that's shortening, never just allowing that stuff to fall back into position. The second thing we did, exact same movement, but now in the prone position. So let's go ahead and get in the prone position. Hopefully my microphone survives the ordeal here. Make sure that my body is completely in the frame. We're gonna go ahead and do the exact same thing. So we're gonna point our toes. I'm using my right leg. We're gonna point our toes down towards the floor, bring them up with our hamstring as far up as we can. And this is where he had most of his mobility limitations as we go into deep end range of flexion. Use the ranges of motion that you have. If you don't have this deep knee flexion range, that's completely fine. That's what you're working to regain. The more range of motion you can regain there, the better. We're gonna externally rotate the knee and bring it all the way back down as much as we can while keeping tension on the hamstring. Again, if you don't have that end range of extension, which is the one that he lost, he would stop his reps at around this end range right here. Work with what you got. The more you can push the boundaries of those end ranges, the better. That's 1 rep. I'm gonna use my full range of motion now. Kick out, all the way up. Bring that heel as close as you can to your butt. Rotate in and kick back out. Keep the tension in the hamstring. Right now I'm pulling with my quad, rotating, pulling with my hamstring. You want to regain as much control as possible over as many tissues as you can. Both are the exact same movement done in different positions. One is done in hip flexion and one is done in hip extension, meaning that you can bias different regions just by changing the position of the adjacent joint, at least of the major adjacent joint. In this case, it's the hip. The next exercise we did in this, the first part, the blood flow routine, was just knee flexion and extension, again in the prone position. So we would practice literally just getting to end range, spend some time here, squeeze the hamstring, breathe, spend some time here, squeeze the hamstring, breathe, spend some time here. I'll have them programmed both by time of squeezing as well as reps. So towards the end of the week, we would get about 50 to 75 reps done of just full flexion, full extension, full flexion, full extension. And with these reps, your nervous system starts to recognize those tissues again. It starts to loosen up a little bit because it feels safe. Whenever we feel tight and we feel weak, that's when the nervous system's gonna kind of block you from accessing that range. The more you strengthen it, the more you provide it evidence that everything is okay and that you're calm, you're breathing through the movement, the more it's gonna allow you to go into different ranges and regain the ranges that you lost through your injury, which is why it's so important to get so many reps in and why it's annoying that we have to do this multiple times a day, but annoying is good in the beginning. The very last part of the blood flow routine is actually loading a little bit more than just with the body weight. And since the limitation for him wasn't that flexion and that extension of the knee, I actually opted to load first the rotation. And rotation is usually the first movement of every joint of the body anyways. And his rotation was pretty good. So I was like, you know what? We have time. Seems like we have the availability and the strength to be able to load something. Let's load the rotation. So what we did is we got a resistance band. I think he actually had an orange one, not a red one. If you want to get started and your rotation feels a little squeaky, maybe don't use the red one. We just did a regular hitch over here on the foot, just like you would in the gym in any other scenario. Pull that out to the side so that we load the lateral tissues first. We go ahead and did one full capsule car, very slowly in control, just exploring that end range of internal and external rotation. We went ahead and did about 1 minute of reps with the load on the lateral side and 1 minute of reps with the load on the medial side. And maintaining that rotational capacity, even though it wasn't the lowest hanging fruit, was probably one of the most important parts of our training as well, because like I said, rotation is the basis of everything. You can only flex and extend where you have that rotation. So making sure that rotation has some sort of stimulus going into it while we do flexion and extension work kind of provide like the base of support for the rest of the work to be done. Like I said, this routine is just a blood flow routine. I'm gonna go ahead in the next part of this video, go ahead and show the capacity routine, which is really called the capacity routine, the compound lift, where this is the primers, the warm up for that. That's what really moved the needle. This routine that I just showed you guys, the past 6-7 minutes, whatever the hell this video is on at this point, is something you can do multiple times a day. This literally, the more you do, the better. The more frequently you do, the better. The more you can progressively overload in different means, the better. And means of progressively overloading are reps, frequency per day, frequency per week, range of motion across one or multiple of these exercises. There's a gazillion ways you can progressively overload it. You can put the adjacent joint in a more end range position and progress it that way as well. For example, instead of having myself in a pretty comfortable range of hip flexion, I can bring myself all the way into end range of hip flexion and go ahead and try to do my knee cars in this position, which is difficult even for me at this point. Find ways to progress yourself, and for the love of God, track it. If you don't track it, you will not see that needle move. Whenever I'm working with a client like this, I always ask them at the end of a week or even at the end of the session that they're doing, rate me your pain and your functionality, both in frequency and intensity, from a scale of 0 to 10. And we track that every single day. The more you track your numbers, the better outcomes you're going to get. Wherever your attention flows, your attention flows, your energy flows, something along those lines, but you're gonna get results in that way. So that is the blood flow routine. Let's move on really quickly to the bread and butter of this routine, of the next routine, which is gonna be the load bearing capacity stuff, which is probably gonna be the biggest singular thing you can do that is going to improve your knee function today. All right, so we talked about blood flow. We talked about how to provide your knees with the fluids, with the nutrients, and with the blood flow that it needs to slowly recover over time. Now we're gonna go ahead and talk about the actual physical stuff, the actual musculature and the connective tissues that are damaged right now in the knee. We can slowly train to rebuild them. We can actually provide our body with the building blocks to create collagen synthesis and slowly start rebuilding, or at least strengthening tissues that were not strong before, which obviously contributed to our tear in the first place. So we have here two isometric exercises, one eccentric exercise and one concentric one. This routine should not be done every day, just like unlike the other one was. We had him doing this, I believe, twice a week in the first week, and then we bumped it up to, for the first 2 weeks, and then we bumped it up to 3 times a week for the remainder of that training block, which lasted 6 weeks. So that's just how he progressed. That's where the skill of coaching kind of comes in. Your progression may look completely different. You may be able to get away with 3 in the first week. You may only be able to get away with 1. So it's always important to pace yourself in that scenario. But to get into the first exercise, we had him use a stretch strap for it. If you don't have access to it, you can use your hands to try to get into this deep knee flexion position. For the sake of the video, I'm gonna go ahead and use the straps just to stay accurate to what he did. We thread it through our ankle. grab it with the hand of the same side leg that you're working with, and pull yourself as far back as you can. Now, I have a pretty good knee flexion range of motion because I don't have an ACL tear. He had an ACL tear. So in the beginning, his knee flexion looked more like this. The whole point of this pails and rails routine that we're about to do is to create more knee flexion. That's gonna allow us more control over the ranges of motion that we've lost. I don't really care what's torn, and it's really weird that I say that because people that come more from the medicine world, they see a very specific tissue that's broken in the body. I care more about the knee function, so if we don't have knee flexion, great. We're gonna find something that we can train that gets us to more knee flexion. So this is it. Go ahead and hold ourselves back here. Again, if you don't have access to the stretch strap, you can use your hands and pull yourself as further back as you can. And you're gonna use your hands as the resistance for the pails and the rails. Pails and rails are basically sets of isometric contractions. We're just generating force through a joint to create anatomical changes in that joint that we're focusing on. Obviously, in this case, it's the knee. And so the pails contraction is gonna look like us pushing away from our butts, trying to get into knee extension, except because my hand is either here or here, I'm not gonna go nowhere. This is the resistance. That's what the I stands for in pails, is isometric. Go ahead and lock yourselves into your deep end range of knee flexion. We're gonna go ahead and very slowly start pushing against that stretch strap at 10% of our full intensity. I want you guys to take a deep breath and give me 10%. Trying to push away for 20, 30, 40. And this is the point where if you're getting to 40, 50, 60% and you're feeling like there's a sharp pain, or if there's something bothering you in your knee, and I mean bothering you to the point where it's painful, not necessarily a discomfort, I want you to ease off and stop here in that intensity. That is one of the biggest ways to progressively overload your pails and rails, is through that intensity, not necessarily through the range of motion. Obviously, we're looking for more range here, but if we can't do that yet, the intensity at which you kick out also matters. So I'm gonna go ahead and say 60, 70, 80, 90, 100. If you guys can't get there, that is completely fine. Try again next week. Didn't get it this week? Try again the following one. Keep going until you can eventually, your body will adapt and you will be able to get a higher intensity in that pails contraction. Let's go ahead and go back to that 50, 60, 70, 80, 90, and 100. Notice how I'm shaking a little bit. Even my nervous system's freaking out. And in 3, 2, 1, I'm gonna say rails. When I say rails, you're gonna let go of that stretch strap or let go of your leg and try to bring that knee further in, closer towards your butt. Of course, I'm getting pretty close to my butt because I don't have an ACL tear. But if you do, this part's gonna feel like the hardest one. Keep pulling, use your hamstring, bring the heel closer to your butt as hard as you can, harder, harder. 3, 2, and slowly relax, place your knee down. Congratulations, you just did your first set of knee flexion pails and rails. Probably the biggest needle mover we have in our arsenal right now. We're gonna go over a couple more right now. We just trained deep end range of knee flexion. Let's go ahead and do the opposite of that. We're gonna go ahead and do the extension portion. For those of us that have the ACL tear, it is very likely that you don't have this end range of motion of terminal knee extension. Very, very likely. He certainly lost it, and it was something that, again, through isometric work, we reintegrated back into his routine. Right now, he has it. So, with the yoga block under our thigh, we're gonna go through the exact same process. We're gonna find the end range of knee extension. What this is gonna look like is if you want to bring yourself a little bit higher up with your hands so you can feel a little bit of the stretch in the hamstring, that's completely fine. Our pails contraction is gonna look like us trying to bring our heel, try to make our heel leave a dent over here on the sand, or in your case, probably the floor. We're gonna go ahead and do again 10, 20, 30, 40, 50, 60, all the way up until 100%. The rails are gonna be the opposite. It's gonna be us using our quads, trying to get our heel up off the floor and get into that terminal knee extension. All right, so let's go ahead and run through our set together. The other leg can either go ahead and do a figure 4, or you can leave it out extended. I don't really care what this leg is doing at this point. Find your position, take a deep breath. You radiate through your core, squeeze your quads, squeeze your hamstring, and 3, 2, 1. Give me 10% against the floor. Trying to bring the floor closer towards you. Notice how the yoga block kind of moved a little bit forward too because of the intensity I'm bringing. 20, give me 30, squeeze your hamstring, give me 40, 50, 60, 70, 80, 90, and 100. Hold the 100. More. Don't lose that position. 5, 4, 3, 2, and rails, opposite contraction. Bring that foot up off the floor as high as you can. More. Hold it as hard as you can. Squeeze your quads. More. 5, 4, 3, 2, and relax. Slowly bring it down. Congratulations, you just did your first set of knee extension pails and rails. So we've worked both the knee flexion aspect and the knee extension aspects in both isometrically, which means we provided the collagen stimulus for our body to rebuild those injured tissues, as well as create more range of motion that we lost because of the injury. We're gonna go ahead now and do our E and Gs. So these are eccentrics. They're actually gonna be a little difficult for me to show in the sand. Let's try it anyways, because we did them in a very specific way in which our foot was sliding out. But ENGs basically stand for eccentric neurogrooving. It is just eccentric loading of a specific tissue. In this case, obviously, of course, it's going to be the knee extensors, the knee flexors. So we're going to go ahead and take our hamstrings to their full length. Let me actually turn my head around so that I can lay down completely. We can. If I can't slide in the sand, I'm going to do the walkouts. Oh boy. Oh, the sun's in my face. All right, I hope you guys can still hear me well because my microphone is not cooperating. So for this exercise, the bilateral version is of course the easier one. If you want to make it a little bit harder on yourself, you can go unilateral first. This position by itself was probably already difficult for you to get in if you have a very recent ACL tear. But basically what it looks like is eccentric loading of knee flexion. Looks like us going from full knee flexion to full knee extension while loading this entire range of motion. So for this case, because I can't slide my foot down because of the sand, can I? Yeah, no, I can't because of the towel. I'm gonna walk it. If you guys wanna go ahead and do it yourselves, you guys will do the exact same movement, but sliding down. If you have socks on and a very slippery floor, that's probably the best outcome you can do. If not, your gym should have like slide circles. Those will work very well as well. I don't have access to them here, so I'm gonna do the walkouts. Get into a glute bridge, take one step with the right, one step with the left, one step with the right, one step with the left. And what we're doing here is we're slowly going to our max end range of knee extension. And the more range of motion we can get, relax, bring back to center. Remember, we want just the eccentric, so we're just working the way out. We're never bringing it back in. That is going to eccentrically load the hamstrings, which are slowly, with every step we take, are getting longer and longer and longer, which is exactly what we're looking for, and particularly getting longer under load, which is exactly what we're looking for when we're trying to train the connective tissue. So let's go again. 1, 2, 3, 4, 5, 6. Count your steps. If you can't get to number 6 on the first week, try on the second week. Every single week, try to get further and further and further away from your glutes. And that's going to be your progression tool, as well as the reps, how many reps you get in this exercise itself. So try to shoot for 2 minutes total of exercise, of reps, just walking out, never walking back in. That is the eccentric. We're going to go ahead and move to our lift-offs, which are going to look very similar to the blood flow routine we did in the beginning. So again, hope you guys can still see me or hear me with me in this prone position over here. My chain's getting mixed up. All right. For the last part of the routine, and this is again the load bearing capacity routine, my goal was to integrate the knee back with the nearest major joint that his body had, which was the hip. And so we did a combination of a knee flexion with hip extension at the same time. So what that looked like is he picked his saver leg. I'm gonna bring heel all the way close to butt, just like we did in the blood flow routine. But instead of going back down once we get here, our goal was to go ahead and squeeze the glute and bring our entire leg up off the floor. Hold 3, 2, slowly parachute it down and parachute the knee down. And that was rep number 1. We're gonna go ahead and do rep number 2. Bring heel close to butt as much as you can and slowly bring that hip up, squeeze your glute, back down towards the floor. One mistake that I always see people doing is once they get here, they get tired, and they just plop it down towards the floor and then plop their knee back down towards the floor. We're looking to control our body, so always make sure that you are controlling your body throughout every single rep. Pull heel close to butt. Bring heel all the way up towards the sky. Use your glutes. Squeeze. 3, 2, 1. Slowly back down. Program for him was around sets of 10 to 15 reps of this last part of the load-bearing capacity routine. Please always remember to progressively overload all of these exercises. If you're not progressing, you're not progressing. So you can do this every single day. If you're not slowly, progressively overloading yourself into more range, more reps, more blood flow, more intensity, a combination of all of the above, more frequency in the beginning, the needle's not gonna move. Always make sure to track your stuff. And always remember, a knee that can do more is a better knee. You're always trying to assess for knee function and for the pain of that knee, and slowly assess yourself, rate yourself higher and higher and higher in that functionality spectrum. And I promise you that with enough work, it may not be as quick as his was. It may take longer, it may be quicker. We don't know. We just know that your body adapting to the inputs that you give it is slowly what's going to allow you to slowly be reintegrated back into your favorite sports and your favorite activities. Hope you enjoyed this video. Hope this was helpful in some way. If you have any questions, please go ahead and leave them either in the comments. Feel free to DM me on Instagram. I'll be happy to talk to you there. If you want to work with me a one-on-one also, the link is probably going to be down there in the description. And yeah, hope you guys enjoyed. Goodbye from St. Petersburg.